Good evening. I'm Dr. Britt Nicholson, Senior Vice President for Development at Massachusetts General Hospital. And while I wish we could all be together in person, it's just not possible. The spread of the coronavirus has affected travel, it's affected work and everyday life for all of us. But I do hope you and your family are healthy and safe. Before we get started in the program, I want you to know that there will be a question and answer session after the discussants have delivered their remarks. And for those of you who want to ask a question, there's a Q&A at the bottom of your screen. You can type it in, and we'll make sure to get to as many of those questions as possible. Despite the need to physically distance, our world is more interconnected than ever. And I'm especially pleased that you're able to join us today for the MGH Fund virtual lecture, a discussion on mental resiliency. Now, in addition to the usual MGH Fund donors, this year we're delighted to be joined by members of our Phillips Society. And everyone here today supports our efforts to provide the best possible patient care in these uncertain times, both now and in the future. Unrestricted dollars provided by the MGH Fund donors help us drive key efforts in all aspects of our mission. Patient care, research, education, and our dedication to the communities that we serve. And the flexibility of the MGH Fund helps us to respond on a dime to unexpected challenges as well as opportunities. It helps us seed innovative programs, and it helps us to invest in talented physicians and scientists and all members of our workforce. And as we've seen during this pandemic, the need for flexible spending and the importance of investing in the MGH Fund has never been greater. Now, our Phillips Society members support all aspects of our mission by including Mass General in their estate plans. And if you don't mind, I'd like to give you a little history here, because it was a bequest that helped build the foundation of our hospital. William Phillips was the first president of the MGH Corporation and was a former Massachusetts lieutenant governor. He was the first person to name the hospital in his will, and as a result, his bequest supported the construction of the Bullfinch Building, the hospital's original patient care facility, now a national landmark and the symbolic heart of Massachusetts General Hospital. Now, to honor William Phillips, Mass General created the Phillips Society to celebrate donors who remember the hospital in their estate plans. And many Phillips Society members also support the MGH Fund. So again, we thank you all. Now for today's topic, mental resiliency. It could not be timelier. You are in for a treat with our expert speakers, whom you'll hear from soon. But next up is Dr. Peter Slavin. Peter is president of Massachusetts General Hospital. And the fact that during the early days of the pandemic, national media often chose Peter as a guest expert to speak volumes about his leadership, as well as Mass General's role in this crisis. In fact, I remember well Peter's appearance on Meet the Press, March 15th, early on in the crisis. And at that time, that appearance, one of the biggest concerns at the onset of the pandemic was that we did not have enough personal protective equipment and supplies to keep our healthcare workers and patients safe. During that appearance, Peter called for the federal government and the private sector to increase the production of these vital supplies to make sure that our frontline workers had the protection they needed to fight this pandemic. So Peter, thank you for your leadership in fighting COVID-19, as well as cancer, heart and brain disease, diabetes, and much more.
Thank you for that very kind introduction, and thank you all so much for joining us tonight. I wish we were in the Liberty Hotel or another conference room, meeting room here in the Boston area, but obviously that is not possible at this moment in time, but we all certainly hope we'll be there before too long. I, like Britt, want to wish all of you and your families the best of health and hope you get through this pandemic unscathed. The last 7 months have been really an extraordinary time in the history of our country and the history of our hospital. Britt mentioned March 15th. It doesn't seem like 7 months ago. It seems like years ago. But I just want to thank all of you, because it was because of the MGH fund that we have been able to support an emergency response program here at the hospital for many years. That program actually swung into action in January of this year when our leaders learned of this coronavirus, this novel coronavirus causing so many problems in Wuhan, China. And it was our early response and planning that enabled us to gear up in so many ways in the fight against this virus. It was really not until the middle of April that we reached the peak of the surge here in Boston and had nearly 400 patients here within the hospital suffering from COVID-19, almost half of those patients being in our intensive care units. We had to redeploy hundreds of staff, physicians, and nurses to parts of the hospital they weren't used to working in. We dramatically ramped up our telemedicine services, which prior to COVID made up about less than 1% of our outpatient activity. And at the peak of the pandemic, 85% of our outpatient activity, now down to about 30%. So in addition to responding clinically, we also responded scientifically as well. As you know, we have the largest research program in the country, and our scientists, many of them sort of pivoted into COVID-19 research, be it studying the fundamental biology of this virus to developing diagnostics, therapies, and participating in clinical trials. So our research program has been very active in this effort as well. And last but not least, so has our community health program. We realized shortly after this pandemic began that we were seeing a disproportionate number of Spanish-speaking patients in the hospitals suffering from this disease. Quickly realized it was the towns of Chelsea and Revere, East Boston, that we have such long-standing and close relationships that were being ravaged by this virus. And we swung into action with the leaders of those communities to try to do everything possible to try to mitigate the spread of this disease in those communities. So here we are in Boston in October of 2020. The number of patients in the hospital is down to about 20. So we're seeing dramatically less illness than we did back in the spring. But I think there's a lot of uncertainty as to what the future holds as people move indoors due to weather temperatures falling, as businesses, schools open up more, and as influenza perhaps begins to rise here in the Boston area over the winter. There are certainly several vectors that might make you think that things could get worse. But I tend to be the eternal optimist and think they may get somewhat worse, but hopefully not nearly as bad as they were back in the spring. We are we continue our planning efforts and are going to remain vigilant and prepared. We are making it clear to our staff and our patients how important it is that everybody get vaccinated with the influenza vaccine this fall. It's actually mandatory for our staff, and the numbers of those our staff who are getting vaccinated is climbing steadily every day. We're also encouraging our staff when possible to work remotely. I'm actually speaking to you from the study at my home. We continue to restrict access to the hospital, which I know is painful for patients as we have to limit the number of visitors they have to just one a day. We're doing that for the safety of the hospital environment, for our patients, our staff. And we can't wait to the day where we can let up on those restrictions. We're obviously requiring social distancing, masking, and hand hygiene throughout the institution. We've created spaces in waiting rooms and workrooms, break rooms that allow people to physically distance and also to eat with the right precautions in place. We've also rearranged furniture, put up signs, installed plexiglass in a variety of different areas in the hospital to protect our patients as well as our staff. And as I said earlier, we continue to promote and encourage the use of telemedicine when that is an appropriate way for patients to be cared for. There are obviously certain things that require in-person care. And as I said, we've created what I think is quite a safe environment. So if you need to be seen in person, you should be confident that you will get treated not only well, but safely as also. So I'm just so grateful to all of you for supporting the MGH Fund and the Phillips Society over the years. These fundraising vehicles are key to the overall success of the hospital. They both provide us with unrestricted support, which is so important to be able to respond to unexpected challenges or opportunities. These are also very important parts of our ongoing campaign, an attempt by the hospital over 7 years to raise about $3 billion. So I want to thank you for doing that. It makes it possible for us to care for the nearly 2 million people a year who turn to us for their care. It enables us to pursue our missions with excellence, and it also enables us to start new programs, do recruitments, a variety of other things that simply wouldn't be possible. So I want to thank you all for your support. And now it's my great pleasure to introduce our featured speakers tonight, who are going to talk about resilience as it relates to all of our brains and psyches, which is particularly important during these trying times. I know we all wish that we could return to the lives we knew prior to this pandemic. That will eventually happen, but in the meantime, we need to get through this, and I hope that these two speakers are helpful in providing you with information and advice that will enable you and your families to do so. Our first speaker is going to be Dr. Luana Marques, who is an associate professor of psychiatry at Harvard Medical School. She directs the Community Psychiatry Pride Program at Mass General and is the Phyllis and Jerome Lyle Rappaport MGH Research Scholar. She is a national and international expert in cognitive behavioral therapy and a leader in increasing access to scientifically rigorous mental health practices. Her decades of clinical and research experience implementing evidence-based practices encompass all types of roles and settings, from frontline staff to CEOs, diverse communities to organizations, both in the United States and globally. She is currently the president of the Anxiety and Depression Association of America, and has authored many research publications and books. Following Luana, you're going to hear from Dr. Louisa Sylvia, who is a staff psychologist and associate director of the Dauten Family Center for Bipolar Treatment Innovation at Mass General. She also directs the Health and Wellness program for the home-based program, a program that some of you are familiar with, that we conduct in association with the Red Sox Foundation, and is primarily aimed at serving wounded or our warriors returning from various campaigns overseas, suffering from the invisible wounds of war. Louisa is also an associate professor at Harvard Medical School, and her major research interests are in developing resilience and wellness programs for veterans and others with mood disorders. And in 2015, she received the Gerald Claremont Young Investigator Award from the Depression and Bipolar Support Alliance. So I think you're in for a real treat with these two members of our faculty, and it's my pleasure to turn this Zoom meeting over to Dr. Marques.
Thank you so much, Dr. Slavin, and thank you all for being here, supporting the hospital. I'm really delighted to speak to all of you today about building resilience. What I'm going to do is I'm going to share my slides with you so that we can all look at it. So, as Dr. Slavin suggested, I direct a program here at Mass General that really has focused on building resilience in our inner city communities. And our vision is really that everyone deserves to learn the skills so that we can decrease suffering and build resilience. So today I'm going to briefly talk about, first, what's happening to our brains in response to the world that we live, and then give you some brief skills to help you build resilience today, right here, and also a link to a course that allows you to actually go deeper on the skills that I'll highlight today. For all of us, as Dr. Slavin suggested, the world is really different. Early in March, we had a peak in COVID-19 in Boston and globally in the world. And we not only had the invisible virus, but also had additional threats to food, shelter, work, racism. For our communities here in Boston, especially in Chelsea, was an epicenter of COVID-19. What that has meant in terms of our mental health is an upsurge in depression and anxiety. A recent report suggests that 41% of the US population currently has symptoms of anxiety and depression. And it's not only affecting all of us, but it has a significant effect on those that are actually caring for us. A recent survey published in a journal suggests that 57% of healthcare workers in New York is screened positive for acute stress disorder. So it's really timely that we're talking about how do we help our brains to bring down the temperature of anxiety, depression, and stress. And I like to think about this through the lenses of what's happening to our body when we are facing a threat. Our brain is really smart. And immediately when perceiving a threat, and all of us are facing an invisible threat currently, our limbic system, the emotional part of our brain, turns on. And pretty quickly, what we feel is our body gets ready for what we know as the stress response: fight, flight, or freeze. Your heart might be pounding, you might tensing up, you're ready to get out of trouble. I like to think about the stress response and some of what all of us are experiencing through the lenses of the Yates-Dobson law. That teaches us that there is an inverse relationship here between our stress, our arousal, and our ability to perform in our day-to-day life. At low levels of arousal, we also have low levels of performance. If you drink a cup of coffee, think about this: waking up in the morning, feeling a little sluggish, feeling like your brain's not all there. As we increase in arousal and have moderate levels of arousal, we also have peak performance. Often people describe this as being in the zone, when things are just flowing. They feel like they're not working too hard in their brains. But as the stress has continued to go on from weeks to months, several of us may have moments when we felt that that arousal and that stress was too much. And that really leads to anxiety, stress, and impaired ability to perform. So my first message to all of us today is that it's okay not to be okay, that it is real that our body is fighting this stress response. But what's really important is for us to observe what's happening, but also really work on building resilience. What can I do to help my brain health, not my mental health, but your brain, so that your brain can get back to the zone? And how do we do this? Very simply, I like to think about this as cooling off our brain. So instead of that fight or flight limbic response, we want to turn on a thinking brain, our prefrontal cortex, because science shows us that by activating our thinking brain, we actually cool off and decrease that limbic response. So let's briefly talk about 5 skills that you may have heard before on ways to cool off your brain. But what I want to do today is, in addition of sharing this skill, I want to scientifically share with you why it's important for us to practice some of these resilience building skills that allow us to cool off our brain. Let's start with unplug and anchor. What I mean here is to actually unplug from the news a little bit, unplug from our computers and our devices. And why would I want to do that? Well, what we know scientifically is that being on the news again and again is activating our limbic system. For example, research after the marathon bombings here in Boston suggested the individuals that watched 6+ hours of news related to the bombings actually have a heightened stress response than those that were actually there. So how do we unplug? Well, I suggest that you consider going back to perhaps watching less news as you did before the pandemic, or following the guidelines of the WHO, limiting news and media exposure to once or twice a day. However, our brains are still in this constant fight or flight and wanting to know more and more. So as you unplug, I suggested that you anchor on things that cool off your brain. Things like practicing meditation and mindfulness, which Dr. Louisa Sylvia will talk more about, or going for a walk, or being able to connect with others, which I'll mention also in a little bit. The next thing I want to think about is charging up. This is based on something called behavior activation. And charging up is based on the idea that we have to spend energy to gain energy. This is particularly difficult when we hit that red zone in the Higgs-Dobson. But our bodies have very similarities to the batteries of our car. We have to drive our cars to be able to actually recharge those batteries. And what I suggest is that we really focus on some of the basic things on charging up. The three most important one is eating, sleeping, and exercising. By exercising, I mean just moving our bodies, as simple as going, cleaning up, moving around your house, dancing with your family, finding ways to ensure that you're getting energy back and bringing your limbic system down so that you can get back to the zone. The next thing that I think is really important, I hear a lot from my patients currently, is the sense of uncertainty. Uncertainty is really uncomfortable for our brains because we really feel anxiety related to it. We want to know what's happening next. The problem is we really, the only certainty we have right now is uncertainty. So how do we manage this? Well, two things I think is important. First is, as best as you can, controlling what you can control. It could be as simple as planning your day, knowing what you're going to do in the morning, in the middle of the day, and the end of the day. Making sure that you have your meals. Try as best as you can to practice sleep hygiene. But I also think that during this pandemic, one of the things that all of us are practicing together is what I consider being comfortably uncomfortable. Really sitting with the discomfort of the pandemic and the anxiety and stress. And the best we can, approaching that discomfort by controlling the things we can control. I also urge all of us to stay connected. I'm delighted to see many of you today. In fact, we have 69 of you here today being connected because we know the connection through even the internet can decrease depression and anxiety and increase life satisfaction. In this study, comparing face-to-face to Facebook connection, we see that social connected can still decrease depression and anxiety. Of course, with the caveat that too much connection this way can also activate your limbic system. So we really need to titrate. And here I remind all of us to connect with those that may not have the ability to be with others, such as our elderlies. We've really have done immense on this. And so early in the pandemic, I talked a lot about how do we stay connected. The reality is all of us now have shifted to a virtual world and the level of connection has been a lot more. Lastly, the importance of being of service. And each one of you here have been of service in supporting the hospital and supporting all of the amazing work that this hospital does. What we know is that being of service in a small or large way really mitigates depression and increase happiness. And I want to really personally thank each one of you for everything you've done for our work here in the hospital in supporting us in being able to continue to be this excellent hospital that we are. We can continue to be a service not only by supporting Mass General, but also there are ways to volunteer online. So in this website here, you can find ways to connect with others and volunteers. One of the things, for example, that's amazing, I heard the city of Chelsea did something this summer that they paid high school students from the city of Chelsea to actually call elderly in the community so that they could be connected. That's an incredible way to be of service and really a way for our community to be of service. So you might be asking, what are additional supports? You're going to hear some more supports from Dr. Louisa, Sylvia, but I want to share with you one that our department developed pretty quickly during the pandemic. We designed a course based on cognitive behavioral therapy that's designed to bring mental health for all. This course is not for professionals, it's not for doctors, it's for each one of us. It actually goes in depth on the skills that I talked about. It has 4 modules, it's very short, and was created through the generosity of Dr. Mauricio Fava and through the Dali Philanthropies. This course can be accessed online and is free of charge given that our department supported it. The need for resilience is globally. Here's a map of where this course has been watched. We released it very recently, and globally we've seen it. We're in the process of actually getting it translated to Spanish, German, and Portuguese to really reach our global community better and support resilience across the world. And this topic has been so important that our research lab here at Mass General has done more than 70 presentations and had really a wide reach on building resilience and sharing the skills that I shared with you today. I want to really thank each one of you for being here today. I'm delighted to talk to you more on the Q&A and continue to thank you and wish you and your family well.
Great, thank you so much. I will hop in with my remarks now. Again, thank you all for being here. I'm going to dig in a little bit more into some of the areas that Dr. Marques did touch upon. And specifically, I heard that people tend to take about 10% away from a talk. So I'm going to make this really simple. I'm going to give you one thing to remember. It's one acronym called MEDS. And the acronym stands for medication or mindfulness, exercise, diet, sleep, and social support. Many of the same things that you just heard around the science for building resilience. But I'm going to talk a bit more about some of my sort of favorite habits and tips to sort of stick with each of these areas. So first, again, starting with the acronym MEDS, starting with the M with medications. Sometimes these really aren't necessary. If you're having difficulty doing things in your everyday life because you're anxious, down, depressed, then a medication can be very helpful. For example, if you're having trouble getting out of bed due to your mood or working effectively or taking care of your children, then it can be important to speak to a doctor. So I certainly don't want to skip over that. It's very important. And then there's a lot of other psychosocial things that you can do to build a resilience, which is what Dr. Marques and I are focusing on today. So the next M for MEDS is mindfulness. Mindfulness is very popular right now, and a lot of people are talking about mindfulness. I'm going to make the definition very simple. It's about staying in the moment, in this present moment. So not focusing on what happened in the past, not thinking about what's going to happen tomorrow, but staying focused on what is happening now. And that is actually incredibly difficult to do. But if you can hone your brain to do that and have that skill, it can really help build your resilience. There are many ways to do this. I'm just going to mention a few. One of my favorite ways to do this is to focus on engaging your senses. So things from chewing gum or sucking on a mint can focus on the sensation of taste. Listening to music can focus on sound, engaging sound. Or burning a scented candle or cooking, things that engage your sense of smell. So those can be very important ways to stay in the moment, again, through engaging your senses. Another way to stay in the moment or to be mindful is to distract with something positive. That could be cooking, playing an instrument, playing with a child, something that really keeps you focused on what is happening now in this moment. And finally, there are actually a lot of fantastic ways to practice mindfulness that are on apps and on YouTube and all over the place. I will mention a few of my favorite apps, which are Headspace and Calm. These are free apps, but you have to be careful once you get into them. They can try and charge you for various things, but there's a lot of things that are free for them. And they have a lot of meditations in there from 1 or 2 minutes up to 20 or 30 minutes. And these meditations focus on things like guided imagery. So again, somebody walking through a scene or an image that you can close your eyes and practice the skill of bringing yourself into that moment. Because really mindfulness is about that selective attention, being able to bring your mind to where you want it to be. And often that could be through something sort of a positive activity or guided imagery or other type of meditation. So lots of resources out there. Research suggests that about 20 minutes of mindfulness a day is ideal. You don't have to do all 20 minutes at the same time. You could do 5 minutes in the morning, 10 minutes at lunch, 5 minutes in the evening, or a minute here or there. It all counts. So think about that as a guideline as you think about trying to practice the skill of mindfulness. Exercise. Dr. Marques mentioned the importance of exercise. It absolutely is one of the most robust ways to support the growth and strength of neurons, and even more importantly, perhaps to help with the connection between neurons. Again, exercise helps your brain stay charged, as Dr. Marques was saying, and that is really important to help you adapt to stressful situations. Now, ideally, we'd all get about 150 minutes of exercise a week, which is about 30 minutes on 5 days a week. But importantly, exercise can be lifestyle activity. It does not have to be running or swimming or something that's very vigorous or intense. It could be walking briskly, it can even be vacuuming, mopping, gardening. It can even be playing golf, However, you do have to walk and carry your clubs, and it can include dancing or tennis or any of those types of activity. And every minute counts. At one point, there was a theory that you had to do at least 20 or 30 minutes to get your heart rate pumping to really make a difference. Now the science suggests that every minute counts. Every minute that you're standing or moving counts. So think about that, again, similarly to mindfulness, as you think about your guidelines for trying to exercise. Finally, diet, or at least the D in meds. The old saying, you are what you eat, is definitely true. You need important micronutrients or vitamins such as folate and minerals such as calcium to respond well to stress. For example, vitamins are necessary for energy production, immune function, blood clotting, and many more things. Minerals help with growth, bone health, again, amongst many other things. In sum, your body needs these to adapt. However, your body does not make a lot of these micronutrients, so we have to eat them. And we eat them through micronutrients, our proteins, our fats, and our carbohydrates. So we want macronutrients that contain a good balance of these vitamins and minerals, ones that are low in fat and sugars that will help your body be charged up and handle stress. Now, making diet changes is really hard. We tend to feel very emotionally tied to our foods. Our foods can be soothing and calming. It can be enjoyable to share a meal with others, and they're delicious, a lot of our favorite foods. So I always encourage people to start with very small changes, changes that will really seem so easy that you would have no problem keeping that change for several months or ideally even longer. I'll give you a personal story. Right now it's Halloween, it's fall, it is candy corn season for me. I love candy corns. I make some rules for myself though, because I know that as much as candy corns are terrible for me, there is absolutely no nutritional value in a candy corn. It's still that I still know that I don't want to cut them out entirely. So instead I make some rules for myself. I say, all right, I'm only going to eat them around this time of the year. I'm only going to have them on weekends. I'm going to make sure that I just have a few or a small handful every time I pick up one of those bags. Importantly, I'm not cutting them out. I think this is one of the crucial things that people do when they think about dieting is they think about cutting out the foods and the beverages that are not good for them. Research suggests that that type of dieting leads to relapse. So instead, think about how you can make your favorite foods and your favorite drinks in moderation, not overdo it. Another quick tip on diet is to stay, when you go to the grocery store, stay to the outside lanes. Everything you really need, well, most of the things you need are in those outside lanes. So things like your fruits and your vegetables on that outside perimeter of the grocery store, your dairy, your proteins and your meats, and even your breads tend to be on the outside of the grocery store. So start there, and then when you need to go get a spice or something down the middle aisles of the grocery store, do that afterwards. But try and do the bulk of your shopping on the outside of the grocery store. A small tip. And now we're on to sleep, or the S of meds. Again, Dr. Marques also mentioned this is so crucial that when we're tired and fatigued, it is so hard to adapt to stress. If you're having a lot of trouble sleeping, again, it might be helpful to talk to a doctor or obtain sleep aids. However, there are also many things that we can do that can hopefully improve our sleep. Here are just my top 5. 1, be consistent. Going to bed at the same time every night and getting up at the same time every morning is really important. That regularity and that schedule can be very important in buffering against the impact of stress. Even if you're someone who tends to be phase shifted, so if you're someone that likes to be up until midnight or 1 in the morning, that's okay. If you're able to sleep in a little bit the next morning and not have that impact your work or other functioning, being consistent and keeping that schedule would be better than trying to shift it back to what might seem more normal. Number 2, you've heard this before, make your bedroom comfortable. I can't underscore that enough though, because we all have things that we could probably still improve upon in terms of making it more comfortable with the temperature, the dark, make it a relaxing and soothing environment, the temperature, and most importantly, remove those electronic devices. Try and keep them as far away from you as you can because they are stimulating and they are engaging and they will keep you up. Number 3, avoid large meals, caffeine, and alcohol before bedtime. I know it seems soothing and you do feel tired after many of those things, particularly a large meal or having some alcohol, but they actually really don't help get you to sleep, nor most importantly, does your sleep quality is worse. So that is the biggest challenge, is even if you do fall asleep, you might have worse night of sleep after those things. Number 4 is exercise. I can't underscore it again. Again, research suggests if you're physically active during the day, you're much more likely to sleep better at night. So another plug for exercise. And finally, and perhaps the most important thing, which seems very counterintuitive, is do not lie in bed awake. When you lie in bed awake, you start to think of your bed as a place to lie in bed awake. And that is not a good, what we call sort of pairing. So instead, we tell people to, after 20 or 30 minutes of trying to fall asleep, get up, get out, and try and do something. It could be something that is, ideally something that is not stimulating, so don't turn on those devices ideally. Don't even pick up your favorite book if you're really into it and you think that's gonna keep you up for an hour or so. We would just want something that will keep you engaged for about 20 or 30 minutes, that is engaging enough to distract you away from your thoughts about having difficulty sleeping and getting you to do something such as coloring, reading a short article in a magazine or a newspaper, and then after 20 or 30 minutes, try and get back into bed. If you can't fall asleep in 20 or 30 minutes, again, get back out of bed. And you keep doing that cycle until you do fall asleep. Some people have told me that that pattern sounds very tiring, and that is the point. So stick with that, try it, but again, try not to lie in bed awake. Finally, support. A key thing to staying resilient is absolutely seeking and giving support. Other people can help us adapt to stress in many ways. And there's lots of ways actually that we can facilitate support. There's informational support, so it's getting advice from friends or a doctor. There's tangible support, such as a neighbor who drives your kids to school, or the old adage, the neighbor who gives you the egg when you need it for cooking. And then there's belonging support. And belonging support, I think, particularly during COVID, has been more and more challenging as we've been isolating from each other. So you have to find a way to find a group or community that you belong to. As communities and community centers and schools and sports teams and other things have been shutting down, that we may have been feeling that sort of sense of community, you have to think about new ways to do it. Playing a card game through Zoom or other ways that you can stay connected are really important during this time. And finally, emotional support. And this is the type of support we often think of when we think of support, but that is when a friend or a family member is listening to you and helps you to process, validate your emotions, and generally feel better about the situation that's going on. Cultivating support in your life from other people will be really helpful. So think about where you can do that in your life. Talk to your neighbor, speak to your friends, try to do what you can to build that support network. So that's meds, medication, mindfulness, exercise, diet, sleep, and social support. Do not try and tackle each of these areas at once. Set goals that are doable. Set goals that you care about. So for example, maybe I do care about exercising more. If that's the case, then I need to also set a very specific goal, not just to exercise more, because that's unclear. How much are you going to try? Maybe this week I try and walk half a mile a couple days a week. Maybe the following week I build upon that, and so on. But then make your goals time limited as well. So a month from now, 2 months from now, check in with yourself and see how you're doing with your goal. Circle back, see if you need to modify or change it. But most importantly, you are never failing. You are never not doing what you're supposed to be doing. Because even just by trying and giving something a go, you're going to learn something from it. And that is what's going to help you to build your resilience. So thank you again for listening, and I'm happy to take questions. And again, thank you for support of Mass General.
Thanks very much to both of you for those really reassuring and wonderful comments. Let's go straight to the questions. So Peter, here's the first one for you. It says, my husband and I over the years have appreciated your calm and reassuring leadership, but never more so than during these last 7 months. You have to have one of the more stressful jobs in the country. What are you doing to keep yourself centered?
Well, first of all, I'm not sure it's one of the most stressful jobs in the country, because we have such an amazing team of 27,000 men and women who are so passionate about what they do, so skilled, and work so hard to meet the needs of our patients and the hospital overall. So, they're the ones who deserve all the credit. I have been following a little bit of Louisa's advice, trying to work on sleep, trying to work on exercise. I have a trainer that I do Zoom sessions with a couple of times a week. I've been playing golf more than I usually do. It's one of the few things that you can do these days that's reasonably safe. So I've been trying to pursue some of those resilience skills that Louisa and Luana have mentioned.
Next question, and Luana and Louisa, I think probably both of you can opine on this one. He says, are there any special considerations around mental resiliency for teens and the elderly? Generally speaking, are the recommendations the same for all ages? You know, as a mom of a teenager and a daughter of an 80-year-old, I'd love to know what the experts say.
Absolutely. So at the bottom of it, the recommendations are very similar, right? So really to build resilience, the recommendation is the same across the lifespan. I think the difference is how you deliver it. If you're talking to a teenager and you're talking about building resilience, you might talk about playing a sport. You might talk about engaging with your friends in a way that's safe. And when we move up, we're talking with elderly, we have to accommodate some of the suggestions that we made to their appropriate life style they have, their physical limitations. But the recommendation we give tends to be pretty steady and pretty consistent across the lifespan. Louisa, what do you think?
I would agree. I would add one of the considerations perhaps for older adults is helping them feel more comfortable on technology, not only with just sort of how to work it, but also sharing. The research suggests that older adults just are more concerned about sharing data and being on things like Zoom and having Zoom crashers and this kind of thing. So just being aware that there might be a little more education around that for some older adults. But otherwise, like everything that I sort of spoke to really is helpful across the lifespan, exactly.
So we have some wonderful questions coming in. I'd like to remind you that any of you who do have questions, please just put them in at the bottom of the chat section. So Dr. Sylvia, you've emphasized several times the importance of exercise. My question is, do we know how exercise works?
It's a great question, and there is a lot of theories out there, one of which is my favorite, which is, I call it exercise builds brain juice, or something else called brain-derived neurotropic factor, which is something that helps to stimulate brain growth in the brain. But there are a lot of other theories around why exercise is helpful, even psychological theories around boosting your self-esteem, your self-efficacy. I actually one time applied for a grant to look at this, and I got denied because they said there's too many ways to look at how exercise can improve mood. So I think the bottom line is the research continues to get better and better in this area, and the link continues to become stronger and stronger. I'm convinced that someday it's going to be just part of our sort of prescription as we go out into the world to exercise, because the literature is so strong in that area.
So this is another question that I'm going to send to both Dr. Sylvia and Dr. Marques. It says, who have you turned to for guidance or strength during these challenging times?
So for me, I've turned to my family and my inner circle, but also significantly to our team here at Mass General. So because we've talked a lot about resilience and really focus on it, and because my work really focused on building resilience for youth in inner city, our team has been one of the greatest support. And we've done things like starting our team meetings by talking about moments of gratitude or talking about how we can best support each other. So I think those are the two things. My 3-year-old at home, my husband, and my team has been really my anchor.
I will echo that. I will also share a bit of something early on that really helped to anchor me, to use Luana's words, which was One of the response that the hospital had in trying to help our frontline workers at Mass General was to offer stress management groups. And so my job at home base, I bring resilience that the Benson Henry Institute for Mind Body Medicine at Mass General has developed over decades of research. They have a very well-validated and excellent stress management program that I help to deliver to veterans, and then had the opportunity in April and May and June to deliver it to frontline workers, mostly nurses and physicians, respiratory therapists. And so I led groups at 6 in the morning and 8 o'clock at night with some of these frontline workers. And just like Luana was stating, being able to sort of be in it together in some small way, even though I was at home and they were most certainly not at home, but just to be able to give them something to look forward to and to bring them together and to bring community. They really appreciate that opportunity. That really helped me a lot to make me feel like I was doing something and giving back to the community that I love so much. And then the other thing is exactly my family, particularly my children, are very grounding. So combination of a couple things.
So Dr. Slavin, how do you monitor the morale or mental health of your employees and faculty? And at this point, do you have any special concerns about that?
That is something that I'm concerned about. As Dr. Marques and Sylvia pointed out, our faculty and our entire staff has been through one of the most exhilarating experiences of their lives, being on the front line, addressing one of perhaps the biggest challenge our generation has ever seen and hopefully will ever see. But at the same time, it definitely took a toll on people, just being redeployed to places that were foreign to them within the hospital, working so hard, seeing so much suffering among patients, caring for patients who didn't have any visitors, and the isolation that they were experiencing and our staff witnessed. And last but not least, being fearful of the disease itself, afraid that they were going to catch it at work, afraid they were going to bring it home to family members. So I think all of those things combined led to quite a bit of stress among our staff, and some of the same issues that members of our military returning from combat experience as well. I mean, I think we have a very good management team, and I think one of the strengths of the management team is interacting with our staff and learning what their state of mind is. And as you've heard, we've tried to provide our staff with all sorts of resources through our employee assistance program and through a series of other programs that were initiated to try to give them the support they need to get through this difficult period. So some of them, I think, as we look ahead to what lies ahead, I think there's definitely some anxiety within the organization as to what the future holds and whether they're going to be put in similarly uncomfortable positions in the future. I certainly hope we don't have to do so, but I'm sure our staff will be ready if they're called upon.
So again, this next question will be for both of you, Dr. Marques and Dr. Sylvia. It says, since COVID-19 began, it seems as though mental health has been more widely discussed as we try to make sense of what's going on in the world. What have you seen happen within the field since COVID-19 began? And has there been a change in the way that you as clinicians approach mental health as it relates to COVID-19? Or has there been a change in the sorts of issues you're dealing with in general with your patients?
That's an excellent question, and several layers there. So at the system level, it is wonderful, honestly, to hear people talk more about mental health and to talk about it from a scientific perspective. That there are things you can do, that there are medication, there are cognitive behavioral therapy, and to be part of the narrative. And I think, you know, it's not only in the national level. For example, we've had conversations with the Secretary Commissioner of Education to think about mental health in schools. So I think being part of the narrative and elevating it has really brought the attention of how much we need to address mental health. And I think a lot of people are leaning towards sort of thinking about its brain health and thinking about exercising their brain in a way that builds resilience. So I think today's timely to do that. The second piece that I want to address, and then I'll pass to you, Louisa, but I really do think that one of the things that I've seen clinically that none of us had ever seen is this combination of anxiety, depression, trauma, and acute grief all coming together. Right? In the literature, we have no protocols for managing acute grief, but we have many situations of loved ones passing the hospital and you're not being able to get to them. And so that real acute grief and inability to grieve. So our Center for Anxiety and Traumatic Stress here at Mass General has been given a lot of thought of how do we address this clinically, and also how do we bring down the wave that potentially could come related to mental health. We know, for example, that after September 11, 10 years out, 10% of first responders still met diagnosed for post-traumatic stress disorder. In the US, it would mean that 1.8 million first responders might still have symptoms of PTSD 10 years out. That's why I think it's important and really timely that our hospital is really attending to all of us and making sure that we're building resilience to decrease that mental health curve.
I'll just add a few other things I think have changed with COVID-19. One is pivoting to telehealth. So we're doing in the Department of Psychiatry a lot more of what you're seeing right now, which is doing calls over Zoom with patients. As Dr. Slavin mentioned, I'm the Associate Director of the Bipolar program, and we had a lot of discussions, for instance, about would it feel more comfortable to try and see patients with masks on and goggles and in our office, or try and do telehealth. And over again, we heard not only from staff, but from our patients as well, they prefer to do telehealth. And so the hospital's really made that possible and done that in quick order, which has been wonderful. The other big pivot has been, I oversee a lot of health and wellness programming, for instance, at home base, and we no longer can have people come into the gyms or a cooking demo, a lot of these in-person programs that we've had. However, so that's a downside, but the upside is that we can now do this nationally. So we can now have cooking demos and people call in from all around the world, and we do it through Zoom. So those are some of the things that are pivoting and changing, and I think we're still trying to figure out exactly how to do these various these programs, but I think there is a silver lining to them as well.
So this one comes in and says, I'm so glad that you mentioned telehealth. Do you think as a clinician it's an effective way to interact with your patients, and are there any downsides that you've observed?
Sure, I'll take it first and then pass it to you, Louise. So research shows us in clinical trials that telehealth can be as good as in person. It's of course not optimal, but before the pandemic, we knew that we could do it and we could do it successfully. And personally, I've pivoted to telehealth, and a lot of my patients have really appreciated it because they can do it more easily. They're in the comfort of their home. So I think there is a huge benefit. For me, personally, the piece that has really hurt my heart tremendously is that just widen the disparities. So there are a lot of patients that don't have access to telehealth in our communities. And so really thinking creatively, how do we reach those that need the most? And I think that's one of the limitations of telehealth that we've been thinking a lot about in our communities.
I would absolutely agree with that. And I would just say one of the other potential silver linings of telehealth is that people are in their home environments, so we don't get to see people in their home environments. So that has been very interesting, to sort of see where they live, see what they're doing. Sometimes it's much easier to do family sessions. It's also easier if someone's not taking their medications to have them go get their medications while on the call and take them with us. So there's things like that which have also changed, and but I absolutely agree that the disparities is a huge problem and something that we really need to think about as we go forth here with this remote work.
And here's a question. You mentioned exercise is a way to cope with stress. I hear different amounts of time as to how much you should exercise daily. I think you covered this, but is 30 minutes a day a standard amount?
A great question. So that is sort of the gold standard that we're trying to shoot for, at least 150 minutes a week. But you're absolutely right. There, it does show, it's sort of a curve that at some point does level off. So the amount of exercise that you do up until you sort of become more like the elite athlete doing a lot of work, that the benefits of exercise really start to level off. So bottom line is every minute of exercise, generally speaking, is going to add benefit to you, unless, you happen to become an ultra marathon runner, in which case, at that point it's not as important. But we do try and get people to try and at least get to 30 minutes, because that's kind of the gold standard.
Okay.
5 days a week.
And the next one is the two excellent speakers mentioned some readings to help us, and I'd appreciate it if they'd mention them again, and are they available at MGH?
So the ones I mentioned, my website, drluana.com, has everything that I mentioned. In our Department of Psychiatry, we also have a pretty extensive COVID-19 website. I don't remember, right? I can look it up, but I don't remember. But that website has most of the things. Louisa, anything to add there?
Yeah, I would say specific to COVID-19, that's a good one. I love one book called Mind Over Mood by Greenberger and Podasky, which is sort of a very user-friendly cognitive behavioral therapy book, not directly related, obviously, to COVID-19, but again, Mind Over Mood is another helpful one that has a lot of these strategies in it.
So Dr. Marques and Sylvia, what drew you both towards a career focused on mental resiliency?
I can take that one first. So as an athlete in college, I found that sports and exercise and a lot of these lifestyle things helped me to get through some stressful times in my life. And upon graduating, found myself in a job in the bipolar program at Mass General, and said, I want to see if this really applies to bipolar patients as well, and individuals with serious mental illness. And absolutely, not only has it, I think really in the last 20 years or so since I've been working in this space, has this really become clear that the whole person, and thinking about all the different areas in which, including spirituality, which we did not talk much about, for instance, there are so many pieces to a human that are important to work on that will contribute to your mental health and your resiliency. And I experienced that myself early on and wanted to make sure that we could find strategies and ways to get that to everybody, even those that may have serious mental illness and have a lot of challenges, potentially.
So for me, as a personal and professional mission, I grew up poor in Brazil, and a lot of the skills that I later learned in graduate school under the umbrella cognitive behavioral therapy were skills that my grandmother actually taught me with no college education. And so when I finished my degree and got here to Mass General, I had the privilege of working with amazing minds. It really, for me, felt like I needed to bring those skills to our inner cities and teach kids that there is a way out and that you can change your brain. And so my mission is really to find a way to bridge the gap between science and practice, from the ivory tower to the streets. And that's what drives me every day.
I think we have time for one more question, and this one is, does the approach to ensuring mental resiliency and wellness issues for frontline healthcare professionals differ from the approach taken for the general population?
I think so when we were doing these groups, let's say, early on, there were some things that were very clear that were happening for frontline clinicians specifically. One of them was, which Dr. Slavin spoke a little bit to, which was the fear of getting other people sick because of their job. So that was very challenging for people who are working in places that they're exposed to COVID patients and having to go home. I also ran staff wellness at Boston Hope, which I think probably many of you are aware that Mass General was very instrumental in getting our field hospital Boston Hope up and running, and oversaw staff wellness there. And that was, for instance, very concerning to a lot of people going to Boston Hope. Another thing that changed, people's identity changed a lot, because also Dr. Slavin mentioned that a lot of the jobs shifted. So people who were maybe doing one role, a nurse in an ICU could be doing something completely different in another area. And so their hours, their strengths that they saw as potentially their strengths at work were all of a sudden sort of turned on their head because they were now doing a different role, a different job that certainly they were trained to do, but it had been a while and they didn't really see themselves as like that was their job. So there's a lot of sort of identity change, hours shifting, so the stress around that, and then I think sort of this uncertainty and fear around obviously their own health, but then getting people sick who are near close to them.
Yeah, I agree completely, Louisa. And I do think that the core, though, we probably use the same skills that we use with the general population. We just had to be more creative and really adjust that the threat was real and how to work through that threat in a way that brought down anxiety.
Well, on behalf of our audience, I know they'd like me to express their thanks and appreciation to all three of you for what really was a remarkably sort of informative program. And to the audience itself, I'd like to express on behalf of the institution our gratitude for the way that you have supported us through the years. We want you to know that we are here for you. We're concerned about your health and we're concerned about your safety. We're here to do not only the extraordinary, but we're here to do the ordinary extraordinarily well. And please be safe. Thanks for joining us.